So in this table, we are going to trace out about antitubercular drugs, right? So TB or tuberculosis is an infection of lung caused by Mycobacterium tuberculosis, organism name. And this first line of medication like isoniazid, rifampin, pyrazinamide, ethambutol, or streptomycin, these anti-tubercular drugs treat all form of mycobacteria, right? TB is most commonly characterized by granuloma formation in the lungs. So lungs is the primary or common site of infection by Mycobacterium TB. But it is also possible TB infection can spread to the other organ like brain, bones, kidney, or liver. So in the also it is another question is important and clicks both asks, and Mycobacterium infection or tuberculosis is a airborne disease or droplet, right? So droplet means droplet are expelled by coughing or sneezing. And when they enter in the new body and they can multiply, right? So, but here we are going to focus only this 5 medication. The first medication we use isoniazid, shortly called INH, right? So in this table, the top one, we talk about the mechanism of action. So isoniazid is a bactericidal. So what are the difference between bactericidal and bacteriostatic? Bactericidal means the medication can kill the bacteria, and bacteriostatics means medication can reduce the growth of bacteria. So isoniazid is a bactericidal and also inhibit the growth of mycobacteria by preventing synthesis of mycolic acid in the cell wall. Cell wall for what? Mycobacterial bovis or Mycobacterium tuberculosis. The bacteria does not formation because cell wall lysis. Whereas the rifampin is a bacteriostatics and bactericidal both properties. They inhibit the DNA-dependent RNA polymerase enzyme because this is the main strength of the bacteria and or virus, right? DNA-dependent polymerase enzyme activities destroy. Whereas the pyrazinamide is a bacteriostatics and bactericidal, and mechanism this is unknown. Ethambutol is a bacteriostatics and they suppress the RNA synthesis, also inhibit the protein synthesis. Last one is the antibiotics we use if the other anti-TB medication does not work well, or multi-drug resistant cases we use streptomycin. Streptomycin is a aminoglycoside antibiotics, right? This is the antibiotics. And here, they have a properties of phagocytosis. They kill the bacteria by phagocytosis process or procedure. So now go the second phase, consideration. It is the nursing consideration. What are the frequent area and collects board arcs? So isoniazid better to take with empty stomach. They work better if you take without food or empty stomach. So the most of the anti-tubercular drugs like isoniazid, rifampin, and pyrazinamide hepatotoxicity. They causes hepatotoxicity. So causes the liver damage. So when patient prescribed by isoniazid, you should educate them what are the sign and symptom indicate they have a problem in liver or medication causes the damage of the liver tissue, right? So if patient develop the jaundice or anorexia or malaise, malaise means patient does not feel good, easily fatigued or tired or nausea. So liver is a major organ of metabolism. If liver does not work, patient develop anorexia, patient develop nausea, vomiting, and bilirubin is metabolized inside the liver. But if liver does not work, bilirubin level go up and patient develop jaundice. So if anybody have this sign and symptom, it indicate liver tissue damaged. Hepatocyte does not work well. So patient should notify to the doctor, or if we see any sign symptom like this, we should document it or inform healthcare provider. So if your patient have a liver problem, but how you has to evaluate the liver is work or not, we should check the liver function test like a AST or ALT. So liver function test should be completed before start the medication, even every weeks or every 2 weeks to check the liver function. Same information we need for isoniazid, rifampin, and pyrazinamide. Right? So what next? Isoniazid also causes neuropathy or neuritis. Isoniazid, shortly we said INH, right? N stand for neuritis or neuropathy. H stand for hepatotoxicity, easy way to remember. So if your patient prescribed INH or isoniazid, and if they complain of abnormal sensation in the finger, it is called tingling sensation, means patient develop peripheral neuritis or neurotoxicity. So how we can prevent the neurotoxicity? By prescribe the vitamin B6. Other name of vitamin B6 called pyridoxine, right? So when you give or prescribe isoniazid, in the same time you give pyridoxine or B6, because pyridoxine can prevent to develop neurotoxicity or neuritis, right? And also it is important let you know the liver function test should be complete prior, before to start medication, liver is working well or not. Also monthly. And also what we should educate our patient, client education. If patient took INH or isoniazid, advise them not to drink alcohol. So alcohol and isoniazid not together. They increase the risks of hepatotoxicity. What next? Next is rifampin. So as like isoniazid, rifampin also causes hepatotoxicity, and again sign and symptom of hepatotoxicity important like jaundice, anorexia, malaise, and nausea. So what client education? So inform the client that urine and other secretion would be orange. So red, some books said red orange. So rifampin started by R, and the urine or any body secretion should be red or orange metabolite. Also P450 induction. We advise the client to immediately report if they see any yellow of the skin. Yellow the skin means increase the bilirubin level, indicate jaundice. Pain or swelling the upper, swelling of the joint, or loss of appetite, or patient complain the malaise, indicate liver damage. Inform the client this medication can interfere with oral contraceptive. So sometimes in a couple use the oral contraceptive or OCP, right? So you make sure they do not take oral contraceptive. If they use oral contraceptive for family planning, tell them to switch other uh, technique or method, because rifampin can interact with oral contraceptive. Pyrazinamide, if we prescribed, always we prescribe the liver function. Why? Because pyrazinamide also causes hepatotoxicity, right? Pyrazinamide increase the uric acid level in the body, and hyperuricemia developed. When hyperuricemia developed and joint pain, and this is gout type in problem. So assess the history of gout is medication will cause adverse effect of non-gouty polyarthritis. In case of the gout, the patient crystal deposit in the joint and causes inflammatory change or arthritis. But pyrazinamide increase the uric acid level or causes hyperuricemia and causes the non-gouty polyarthritis. Liver enzymes should complete before or every 2 weeks to check the liver function test. What is the client education? Instruct the client to drink a glass of water with each dose and increase the fluid during the day to prevent the gout. So I said in case of pyrazinamide can cause uric acid level go up. So if you take enough enough water, that water can expel out excess uric acid and prevent the gout. Let me read it again. Instruct your client to drink a glass of water with each dose and increase the fluid intake during the day to prevent the gout. And also we can prevent the kidney problem. So too much drinking water help to expel out the uric acid and prevent the gout. Advise the client to immediate report If they can see any change like yellowish of the skin, pain or swelling the joint, loss of appetite or malaise, all of the signs indicate liver problem. Advise the client to avoid using alcohol while take pyrazinamide as like as isoniazid. Avoid alcohol. What is the rifampin? What you could educate your patient. Inform the client that urine or other secretion orange. We read it already. So next here, the ethambutol. The ethambutol start by letter E and they causes eye problem. So we should check the visual acuity. Basically, ethambutol reduce visual acuity. Okay, so E for ethambutol, E for eye, and also determine the color discrimination abilities. Ethambutol can cause red and green discoloration, and they cause optic neuritis. So it is very important to determine the color discrimination, especially red and green. This medication should not given to the children who younger than 8 years old, right? Because they can cause permanent damage, the denture. And stop the medication immediately if we see any eye toxicity or ocular toxicity. And also what we can educate our patient, instruct the client to avoid change in vision immediately. If vision change, we should inform healthcare provider immediately. The last medication we use in TTB are streptomycin. The most important point about the streptomycin is an antibiotic, but we use for anti-TB medication. Second point, that streptomycin has a it is a danger or risks of develop the toxicity. Usually we do not use. But if the other anti-TB drugs does not work or resistant, in that case, we do not have any other choice and we use the streptomycin. Streptomycin, I said, high level of toxicities. This medication should use only the client who have multi-drug resistant TB, like isoniazid, pyrazinamide, or other anti-TB. It does not work. It is called resistant TB. Like you prescribed a patient to take isoniazid and pyrazinamide. After few weeks using this medication, they came back and complained, I have a fever, I have a cough and sweating. Means medication does not work. It is resistant. In that scenario, you could use streptomycin. So NCLEX would ask, in case of multi-drug resistant TB, what are the drug of choice? Streptomycin. Streptomycin can cause ototoxicity. So monitor the hearing function. So ethambutol can cause eye problem. Streptomycin causes ear problem. Visual acuity check for ethambutol due to the streptomycin hearing test, ototoxicity. Also report the change of urine output or renal function. So if anybody's urine output is less, scanty, indicate the kidney does not work. So advise what you should advise your patient. Advise the client to drink at least 2 liters of water. So to avoid the kidney toxicity. What are the other medication you prescribe to take enough fluid? Pyrazinamide, right? Because pyrazinamide causes gouty polyarthritis. Advise the client to notify to provider if any kind of hearing problem. This is the side effect of anti-TB medication, and this is the information we should know, and it is help us to educate our patient regarding anti-TB medication.